Good afternoon, everyone, and welcome to today's webinar, Moving Together, Practical Strategies for Promoting Physical Activity in Primary Care. This is the second session in our collaborative series with Active Geelong, which aims to promote physical activity in primary care. My name is Katrina Martin. I'm the Senior Manager of Regional Partnerships and Public Health at Western Victoria Primary Health Network. I'll be your facilitator for this event. I'd like to begin by acknowledging the traditional owners and custodians of the unceded lands and waterways on which we live, love, work and play. We recognise the diversity, resilience and the ongoing place that First Nations people hold in our communities. We pay our respects to the elders, both past and present, and commit to working together in the spirit of mutual understanding, respect and reconciliation. We support self-determination for First Nations peoples and organisations. I'll just run through some housekeeping first. I've got a selection of our upcoming events on the screen now, including the next Project Echo series on emergencies in primary care and the statewide immunisation forum in October, which is a collaboration between all of the Victorian PHNs. Jade will put the link to our events website into the chat where you can look at what else is coming up and register for the ones that you're interested in. Most of our webinars are recorded and you can view these on our PHN Learn YouTube channel. Jade will put the link into the chat for you for that one as well. It's a real treasure trove and I highly recommend checking it out. For those who missed it, the first webinar in this collaborative series with Active Geelong titled From the Sofa to Safe Walking can be found on our YouTube Learn channel as well. That's had over 50 views to date. We've also got our primary care conference coming up very soon. It's only a few weeks away. It's to be held at the Goods Shed in Ballarat on Friday the 10th and the 11th of October. If you haven't yet registered, please follow the link in the chat to do so. Along with an amazing program of speakers, there are skills sessions on wounds, dermatology and practice management HR. Just a reminder also about Health Pathways. Health Pathways is a free online resource with localised clinical and referral information for health practitioners, including nurses and allied health clinicians. Please note that from the 22nd of September, the generic Health Pathways login will be switched off and users will need to use their own personalised login. It's a really easy process and it gives users a better experience along with improved security. So Jade's just put the link into the chat for you for that as well. We do issue certificates of attendance to the participants. So please take a moment to check that your full name is displayed accurately on your screen. If it's not, or if you're unsure, please rename yourself or type your first and last name into the chat box. This will ensure that we can issue that certificate of attendance for you. This event is being recorded. You would have had that alert come up on your screen. Please keep yourself on mute unless you'd like to ask a question. We do encourage interactivity and discussions in our webinars. And so please feel free to type questions in the chat box at any time or take yourself off mute during the designated Q&A session time at the end of the presentations. And finally, your feedback is really valuable to us and it helps us to continually improve our education program and also provide feedback to the presenters. So please take the time to complete the event survey after the webinar. You can access this by clicking on the link in the chat, excuse me, or scanning the QR code on the screen. We'll also show this slide again at the end. So as I mentioned earlier, this is the second session in our collaborative series with Active Geelong. This series is designed to support primary care teams, particularly nurses, in promoting movement through practical team-based approaches. Excuse me. In today's session, we'll highlight real-world examples, including how practices are streamlining referrals to the LIFE program and offer strategies to better support patients who are less active. I'll now hand over to Professor Hugh Seward, from Active Geelong, who'll lead us through today's session. Thanks, Hugh.
Thanks, Katrina, and welcome everybody, and thank you for sharing your lunchtime with us. The purpose of this, the second webinar, like our first one, is to provide you with improved knowledge and understanding, but also give you some skills about how you, within your role in general practices, can encourage your patients to improve their lifestyle and include physical activity as part of those improvements. For many of your patients, it can be a real challenge, and we recognise that, and hope that some of the information we can give you today can help you with those challenges. Following me this afternoon, we have Sarah Dubé, who's the Strategy and Engagement Lead from Diabetes Victoria. And then we have Aaron Beecroft, who comes from IPAN at the Institute of Physical Activity and Nutrition at Deakin University, and he's an exercise physiologist with expertise in promoting physical activity and a particular interest in the role of GP practice nurses. And the wonderful Janet Ashton, who leads Active Geelong's walks in the Geelong region. So you're all well aware that physical activity is good for us. And just as a really brief summary and to recap, we do know that when we look at lots of health issues that your patients have, physical activity can actually prevent and reduce the risk of lots of those conditions. And the ones listed in this circle, it's considered that physical activity can reduce your risk of dementia by up to 30%, by hip fractures by up to 68%. And importantly, in the area of mental health, it can improve and reduce the risk of depression. It also can be used to help manage anxiety. Breast cancer, colon cancer can be reduce your risk, and certainly, as Sarah will talk about, you'll well understand the role of diabetes and, of course, cardiovascular disease, which brings us to that all-cause mortality can be reduced amongst those who are physically active by up to 30%. But we don't sit alone, Active Geelong, or even in our region of Western Victoria, about our concerns. This slide comes from the World Health Organization, and it's given guidance about how to, and this was the in 2020 that they released this, but it stands the test of time. That if we're going to make a significant change across our community, not just for our patients, we need to create active societies, create active environments, creating active systems, as well as creating active people. And so Active Geelong has an aspiration to make our city, and in fact our region, the most active region in Australia. And we're doing this by a number of ways, and this webinar is one of those help that we're trying to provide for general practices to work to improve their patients' lifestyle. So I'm now going to pass on to Sarah to begin her presentation. Welcome, Sarah.
Thank you so much, Hugh, and thank you very much, everyone, for having me here to talk about the LIFE program. Firstly, I'd like to acknowledge the traditional custodians of the lands that we're on. For me, that is the lands of the Boonwurrung people of the Kulin Nations, and I pay my respects to elders past and present and any Aboriginal colleagues today. Now, what am I going to talk to you about? I'm going to give you a brief overview of the LIFE program and what it is. I'll touch on participant outcomes, but most importantly, I would really like to talk to you today about what makes people eligible for the program and how patients can be referred in the program as well. So what is the LIFE program? I actually hope that you've already heard about this program before, but if you haven't, it is the largest type 2 diabetes, heart disease and stroke prevention program in Australia, and it is fully funded by the Victorian government, managed by Diabetes Victoria and delivered by local providers across the state. It is completely free for eligible participants and fully evidence-based and delivered by qualified health professionals such as dietitians and exercise physiologists to help your patients make small changes in their day-to-day habits to improve their nutrition and physical activity, and also to manage stress, and over the longer term also reduce their risk of type 2 diabetes, heart disease and stroke. So yeah, as I mentioned before, the program is fully evidence-based. It's developed from a number of studies and trials. It's developed based on the Finnish prevention program, the Greater Green Triangle Diabetes Prevention Program, the Goal Lifestyle Implementation Trial, and also the Victorian Government Department of Health Healthy Living Course Randomized Control Trial. So it was developed in 2007, and we recently celebrated that we've been running the program for 15 years. So what are the options for patients who want to enroll in this program? Now, it started in 2007, as I mentioned, as a face-to-face group course delivered in people's local areas. Since then, we have pivoted to also online delivery, telephone health coaching, as well as adaptation of the program into a number of languages. So we now not only deliver the program in English, but also in Chinese, Vietnamese, and Arabic, with completely translated resources and bicultural facilitation. So yeah, we have many different options available now for our patients. And last year, we also launched a new adaptation of the program for women with a history of gestational diabetes, and that's now available in English and Vietnamese. So yeah, as you can see, quite a few different options for different communities and cohorts. So what does this program look like? I'll just briefly talk you through what the group course looks like and what the telephone health coaching option looks like before we sort of go into looking more at what makes people eligible and some really easy ways to refer patients. So the group course, as I mentioned before, can be delivered. People can do that face-to-face in their local area if we have a provider available. We have over 60 providers across the state. So it's quite likely that your patients will have a local provider, but if they don't, they can simply do the program online as well as telephone health coaching. So each group program starts with an individual session that the patient has with their group facilitator. And as I mentioned before, facilitators are generally speaking dietitians and exercise physiologists, and they have first that one-on-one meeting where they discuss the patient's health goals and what some of the barriers may be for the patient to achieving their health goals, and what some of the strategies may be that they can use to overcome those barriers throughout the 12 months. Then the first session of the program really looks at understanding of some of those modifiable risk factors and what are some of the risk factors that they can be working on throughout the course of the program. Then the next session focuses on nutrition and improving eating habits. This is always facilitated by a dietitian. So even if the course itself is actually facilitated by an exercise physiologist, they will then bring a dietitian in to deliver this part of the program. The same goes for the session that follows on physical activity and increasing that movement, reducing sedentary behavior. If the group course happens to be delivered by a dietitian, they will then bring in that EP to make sure that they can lead this part of the program. From there, we focus on stress management, overall well-being. In general, what we cover in this session is improving sleep and improving stress management techniques as another way to improve our overall well-being and reduce that risk. Then After that session 4, participants get an opportunity to sort of step away from the learning in that group environment and implement what they've learned themselves, and also have some of those setbacks and challenges and finding ways on their own with some peer support that they can also receive through some group chats that we have set up to really overcome those barriers and work on their health. Then they regroup at that 6-month mark and discuss how they've gone and further ways to improve, how they can improve their well-being and navigate some of these challenges. Then again, they step away from the group, implement some of the learnings, and then meet again at the 12-month mark to plan for continued success. So this is in a nutshell what the group course looks like. We often talk about it as like a 12-month program, but it's actually more a 6-month program with a regroup at the end. So the majority of sessions, as you can see, take place at the very beginning, and then they have a lot of opportunity to work on what they want to implement themselves, and then they get back together and review. Now, the telephone health coaching option is something that suits many participants, of course, because it's quite flexible, and it's quite different from the group course in that it is less structured. So a participant might come in and want to work on all of the elements that we discussed before. So they really want to work on improving their nutrition, increasing their physical activity, and also improving their stress management. But it can also well be that they come in and say like, well, I've already got my exercise routine down patch. I really need to work on my nutrition to reduce those risk factors of diabetes, heart disease, and stroke. And that may then well be all that they will be working on with the telephone health coach throughout that time. So that is in a nutshell what the telephone health coaching option is about. Now, just briefly also highlighting to you some of our participant results. We report back to the Department of Health, obviously, because we're funded by the Department of Health. So it's really important that we have a rigorous evaluation of the program, which we do every financial year. The results from this last financial year haven't actually come in yet. We're still working through those, but just a little snapshot here of what the results look like for the 23-24 financial year. As you can see, we were very happy that at least 67% of participants actually managed to improve their diet. 57% of them improved their physical activity. A little bit less than 50% reduced their time spent sitting. And while our program really focuses on holistic health, and we try to not, constantly put too much emphasis on weight loss, we were still very glad to see that on average, our participants lost 2 kilos and reduced their waist circumference by 3 centimeters throughout the program on average. And maybe more important than anything is that a majority of them reported that they were very satisfied with the program and that they had a much better understanding of their risk factors and how to reduce those risk factors. Now, this is just a really short, I'll just touch on this, I won't stay with this for too long, but we always get really excited when we get, success stories from our participants in, and we have plenty of those to share where we really see that participants have not only been able to benefit themselves by doing the live program, but have also been able to benefit their wider family and often their network of friends. And this is just, one of those really important and positive stories where Eliza completed the live program after she was diagnosed with gestational diabetes in her first pregnancy. She was able to make some very significant improvements to her health throughout the program, and then did not develop gestational diabetes during her second pregnancy. So that was a really important outcome for her. Now, I'll briefly touch on the eligibility criteria for the program and also the MBS item numbers. So there are 3 different ways through which participants can be eligible for the program. I would like to emphasize that they only need to meet 1 of these criteria listed, not all 3 of them. So they can either be eligible through the OSDI risk plus BMI, so if they're 18 years or over and have an OSDI risk of 12 or above, and a BMI of 25 and above, they're eligible for the program. Or through our criteria B, if they have an intermediate or high CVD risk score, Or the last one, if they have a pre-existing medical condition, for example, cardiovascular disease, gestational diabetes, or pre-diabetes, and a number of other conditions as listed. So I'll briefly show you the MBS items. So you're probably quite familiar with these, but the criteria A is connected to 701, 703, 705, and 715. And then the heart health check that all of you would be familiar with as well, connected to 699 and 177. And then there's also the criteria C connected to the chronic conditions management plan and review. Now, I think for us, what we would really like to drive home, I guess, today is that referring your patients to the live program is very easy. And we have a whole range of ways in which that can be done. And for clinics that actually serve our priority population groups, which includes actually many different groups, but we mainly look at regional communities, cold communities, Aboriginal and Torres Strait Islander communities. So if you serve communities that fall within the life program's priority population groups, you also get an incentive, quite a nice incentive actually for referring into the program. So I'll show you that in a few minutes, what that incentive looks like. So there are obviously multiple benefits to referring in. So you can really help your patients improve their quality of life, improve their health outcomes in the short term and in the long term, but also really significantly reduce their risk of chronic disease, including conditions like type 2 diabetes, heart disease, and stroke. So yeah, I just wanted to talk you through a number of ways that you can make it much easier on yourself to make this part of your day-to-day practice. So many of the clinics that we refer a significant number of patients in and also get incentives for these referrals, they use POLAR to screen for patients that would be eligible based on the OSD risk or the CVD factors, as well as criteria C. So POLAR is one way to do opportunistic screening and make it much easier to identify these patients. So if you have POLAR installed, you can start using that straight away to run these recipes. If you don't have it installed, you can contact your PHN and get that organized. So here's just in a nutshell what the process is. So on the right-hand side of the screen, you can see our general practice referral form. You simply complete that form, send it to us via email or fax, and that's how we enroll the patient into the program and make sure that you get your incentive paid. So firstly, you just need to make sure with any patients that you refer that you get their consent and that they also understand that they're going to be referred into this program that is going to help them improve their nutrition, increase their physical activity, and manage stress. So sometimes we get patients who actually don't really understand that they've just been referred, and that's then, of course, not a good experience for the patient or for us. So you just need to make sure that they understand that they're giving consent and that they're going to be referred into the program. Then you need to submit the referral form within 30 days of seeing the patient. The form is available as an editable PDF, but probably more importantly, because we always receive feedback from clinics that they absolutely love the fact that it's also available as a template that can be imported into best practice and medical director, which obviously is beneficial as a large part of the patient's details are already then pre-populated. If you prefer to use paper referral pads, we have those available too, and they can be ordered from the live website. So yeah, you can use like any of these different ways in using the form to complete the documentation and send that to us. And on the form is our fax number and email, and you can simply submit the form there, including the pathology, because you also need to submit pathology results from the last 12 months to confirm that diabetes has been excluded. Lastly, we do also have an e-referral portal which makes it in its own way easy to refer patients. You will have to put in all the details, but you will not have to email or fax anything, because once the details are there, you can simply hit submit, and all the information will then get into our Salesforce database, and from there we will create the patient's account for the program. So if you're interested in getting a e-referral account set up, you can contact us as casefinding@diabetesvic.org.au. But I can send you probably some information a little bit later about how to do all of this. Now, we know that all of you are busy, and that sometimes referring patients into yet another program is an extra step, and that there's not always time, which is why I would like to show you or talk you through some case studies of clinics that refer high numbers of patients to our program, and that have really come up with a very, very streamlined way in their practice to do that. So the first case study is actually a clinic that is part of a quality improvement project that we have been running with a PHN, and the practice manager of probably actually the highest referring clinic, she uses Polar to run recipes for criteria A to identify eligible patients. She then directly contacts these patients and offers them a type 2 diabetes risk assessment with the GP. The OSDI risk questionnaire is then conducted as part of the referral form with the eligible patient, and then they may be referred to the relevant to get pathology to exclude diabetes if that is needed. So if they don't have up-to-date pathology, they might need to refer them as well to pathology. The recent pathology is then reviewed during that appointment, or a follow-up appointment is made to then determine eligibility. And then the GP and the nursing team together prioritize a live referral when a patient meets the criteria based on the OSDI risk and those pathology results, and diabetes has been excluded. So that's important. So that is just one way that a clinic refers quite a large number of patients and also gets quite a nice incentive. So they are eligible for the incentive, so they not only benefit their patient's health by doing this, but also they really increase quite a lot of revenue for the clinic. Here's a second example. So this clinic focuses more on the care planning arrangements. So when discussing care planning arrangements for a patient, the GP reviews recent pathology, again to exclude diabetes, or makes a referral for up-to-date bloods. The practice nurses then discuss the live program with the patients who are referred for health assessment as part of their care plan. And then the CVD risk assessment or type 2 diabetes risk assessment is conducted. They promote the program as free, of course, and something that can really help patients with their type 2 diabetes and cardiovascular disease risk reduction. And it's promoted in conjunction with the GP-CCMP for managing sustainable behavior change, and highlighted to patients with a financial disadvantage. So yeah, we essentially take anyone in the program who is at high risk of type 2 diabetes and cardiovascular disease, but you can probably understand that considering it's a completely free program and it has so many benefits, it's really, great for people who normally would not be able to afford a dietitian or exercise physiologist. If a patient is declined, in this case, a note is made in the file to review their interest in the program when conducting a review of the care plan. Now, one last case study that I would like to talk you through is, again, a clinic using Polar, but this time they actually screen for any eligibility criteria as part of criteria C. So practice nurses use the patient screening tool to identify the patients that they're preparing the care plan for, or the care plan reviews the day before the patient comes in. So a patient's pre-existing chronic medical conditions are then cross-checked by using Polar with life eligibility criteria C's list of conditions. They retrieve recent pathology, again to exclude diabetes and confirm eligibility criteria, or eligibility, sorry. The GP and the nursing team then again prioritize discussing a live referral when a patient meets the criteria of the pre-existing medical conditions when organizing a GP CCMP. And that's really used as an opportunity to promote long-term health for the patient and support. So yeah, I hope that that gives you a bit of an idea of different ways in which clinics cleverly use Polar, for example, to identify patients, and how GPs and practice nurses then work together. Practice managers, I would say, nurses and GPs all work together to streamline the processes so that they can refer as many patients as possible that meet those eligibility criteria. Now, I just would like to touch on the incentive briefly. So as I mentioned, any clinics who serve our priority population groups are eligible to receive the incentive for referring into the LIFE program. So that's done into installments. So you'll get $20 plus GST for referring an eligible patient. And then you also get $25 plus GST once the patient completes the first session of the program. If you're interested in receiving the incentive, I've got our contact details on the last slide, and you can get in touch. And I'm sure that through Katharina, we might be able to send you some information as well after this session on this. So here's just a recap on how you can optimize referrals into the LIFE program. Number one is obviously ensuring that your patient is eligible through one of the 3 criteria. Make sure that you provide, you complete the referral form with the patient, of course, and get their consent and provide them with updated information about the program so that they have an understanding of what they're actually enrolling in, and get them a bit excited about I'll get into that. Oh, the incentive payments. No, they're there. Sorry, I got a message in the chat. I can touch on that in a second. Yeah, so make sure that the patient actually understands the program and all the benefits, and get them a bit excited about how they can actually use the program to improve their shorter and longer term health and reduce that risk of chronic disease. And it's always good if you can follow up with the patient as well in any future appointments and ask them how they've been going with the LIFE program. Are they achieving results? Are they enjoying it? And so on, to keep them engaged. Now, we have plenty of resources that you can order by scanning this QR code, or you can go to our website, lifeprogram.org.au. So we have many resources in English to promote the program, but also in Chinese, Vietnamese, and Arabic for those communities, to help raise awareness of those different streams that we have available and get people enrolled. And there's also information for GPs available through this order link as well. So if you want to get a bit more of an idea of the program, about the incentive and so on, you can download that sheet too. And that is it for me. Please take our contact details if you'd like to receive further information about the program, if you'd like to start referring and you're not on our database yet, if you'd like to receive the incentive. We, of course, hope that from here onwards, all of you will start referring into the LIFE program and make sure that you can help your patients benefit with the program as well. So yeah, thank you very much for having me, and I will hand over to Aaron now from IPAN at Deakin. Thank you.
Thank you very much, Sarah, and thanks everyone for having me today. So as Hugh mentioned at the start, I'm Aaron. I'm an exercise physiologist, but I'm also doing a PhD, which is looking at the role that practice nurses can play in this space in promoting physical activity and sedentary behaviour change to their patients. So I've been able to speak with many nurses, including those in Western Victoria, in some initial interviews that I've done in my research. So definitely have a vested interest in the role that nurses especially can play in this area. So my presentation as part of today's webinar. I was just going to provide a review or an overview of the physical activity and sedentary behaviour guidelines, and provide a little bit of a background, I suppose, to the initial questions, or why you would ask the initial questions and complete screening with the patients when you're seeing them in practice. So to start with, and Hugh summarised nicely at the start, the reasons behind we want to promote physical activity in obviously everybody and in our patients. There's lots of obviously physical and mental health benefits that exist for keeping people physically active. And this is why the first aspect of the guidelines is for people to complete at least 150 to 300 minutes of moderate intensity aerobic physical activity, or to complete 75 to 150 minutes of vigorous intensity activity, or the equivalent combination of the two. So this aspect of the guidelines is the one that, when I speak to nurses, they're the most familiar about. And I think in general, people are more familiar about this aspect of the guidelines. And it's easily broken down when you think about, completing the 30 minutes most days of the week, that sort of thing. The second aspect of our guidelines are the strengthening recommendations. So this is for people to complete 2 days a week of muscle strengthening based activities, and ideally targeting most major muscle groups. So this is obviously especially important for our muscle and bone health, and can also be tied in, especially when we're talking about the older population, that falls and balance-based activities and those functional activities as well fall into these recommendations. So there's obviously lots of ways that people can achieve these muscle strengthening activities. It doesn't have to be in a gym with heavy gym equipment and things. We can do lots of these activities just at home using things like dumbbells, TheraBands, water bottles, etc. And we can obviously use body weight type exercises as well, as the example shows there. There's push-ups against a park bench, sitting and standing from a chair, etc. So that's the second part of our guidelines there. And the third aspect of the guidelines is the sedentary behaviour aspect, which is to limit the amount of time spent sitting and to replace that time with physical activity of any intensity. So I think that this is obviously an aspect of the guidelines that falls away a little bit as well, that people, especially nurses, are less known or less understood and less thought about. And I think part of that is that they're very vague recommendations as well. So I think the main recommendation or thing to think about for people is to really break up long periods of sitting. So we want to try and prevent those long periods of sedentary behaviour and break those up as often as possible. So thinking of every 30 minutes to an hour, getting up and moving around for 2 to 3 minutes at a time as best you can. So just looking at, there we go. Looking at physical activity intensity. So as the guidelines there mention, that moderate and vigorous intensity. So starting and looking at the left there, looking at our total physical activity spectrum, obviously we move from sedentary behaviour into that light intensity towards then moderate to vigorous intensity and that intense exercise, which is more your competitive sport and that type of thing. So obviously in general, we want people to be moving at any intensity and avoiding those long periods of sedentary behaviour, as I said before. But in relevance to the guidelines and looking at sort of what is our moderate or vigorous intensity activity. So we know that, and as you can see on the right there, that our moderate activity obviously gets our heart rate and our breathing rate up, but we can still maintain that activity for a period of time. So it said that you can talk, but you can't sing when you're doing moderate intensity activity. Whereas vigorous intensity activity obviously is even harder to sustain. Our breathing rate and our heart rate's even higher. We're more short of breath, and we're moving into not being able to talk complete sentences. So for working with our patients and the people we see, especially those who are maybe starting from a lower base and aren't as active and needing to increase their activity, it's more palatable and safer for those people to start with light and moderate physical activity than it is to work or push them towards that vigorous intensity activity. So that's often where we start to focus on those 150 minutes of moderate activity, as opposed to the vigorous activity recommendations for people, especially those who are starting out or that old adult population as well. This here is just an example of, and I suppose the main point from my little presentation today is to think about all three aspects of the guidelines as I've presented them to you there. So this just looks at the waking hours of an older adult, an older retired adult, and looking at their activities throughout the day. So in this example, this person has done 3 lots of 10 minutes of active active bouts. And so they've completed their 30 minutes of activity for the day. And if we assume that this is at a moderate intensity, then they tick the box to have met those or that proportion of the guidelines. And then so if we stop there and don't ask that question around their sitting behaviour, we miss the opportunity to potentially even benefit their health outcomes that little bit more by reducing their sitting time. So as you can see, obviously along the top line they're spending a lot of time in that prolonged sedentary behaviour or prolonged sitting state. And so there's opportunity for them to hopefully break up some of that prolonged sitting time, which will benefit their health. For example, it can benefit their diabetes management if that's relevant for an example, and obviously achieve better health outcomes by also paying attention not just to the activity, but to their sedentary behaviour as well. So in summary, we want to encourage people to achieve or work up to that minimum of 150 minutes of that moderate intensity physical activity or the combination of those intensity levels. We want people to, if they can, be completing 2 sessions or 2 days a week of muscle strengthening activity, and then also to limit or break up long periods of sedentary behaviour as best as possible. Also, and is always relevant for people in this space, that on any given day, on any given week, that nobody's perfect, and we know that doing any physical activity and any movement is certainly better than doing nothing. So encouraging activity and especially encouraging people to be moving rather than sitting where possible is always always beneficial, and the evidence certainly backs up that doing any sort of exercise or physical activity is better than nothing at all. To finish with, just wanting to touch on where Australia is sitting in regards to the guidelines and these behaviours. So there is some updated data, I believe, coming in the next month or so. So we'll get a little bit of a better picture of where Australia sits in regards to the guidelines. But looking at them, so on the right there is the proportion of Australians meeting the physical activity guidelines. So there was a bit of an increase in 2022, which was positive, and we'll see if that's been sustained. But nonetheless, there's still nearly 1 in 2 Australians who aren't meeting these guidelines, which points to the need, obviously, as Hugh said at the start, to promote activity and promote that through primary healthcare, capture those people who aren't meeting those guidelines especially. And there's less data around sitting behaviours, but as you can see there's a large proportion, almost or over 50%, especially amongst that older adult population, that describe their day as mostly sitting as opposed to mostly standing or mostly walking, etc. So there's certainly a need to ask those questions around people's sitting behaviours and try and reduce that as best we can as well. And just before I finish off, there's just touching over the staircase approach, and I included this in the last webinar that we did as well. Nurses that I talked to around this area in terms of helping people with their movement behaviours, are very aware of everyone's obviously has their own routines and the need to individualise the advice based on the readiness of their patients. So this approach takes that into account, and especially for people who are just starting out and needing to increase their activity from a very low level. We, rather than jump straight to the physical activity and straight to that yellow section of our moderate activity as per the guidelines, we can start by firstly addressing their sitting behaviours by promoting just that standing and moving before increasing their overall movement and that light physical activity, before we then look at more structured exercise or that moderate physical activity as per the guidelines. So we can help them move up in that staircase or that stepwise approach to modify their movement behaviours. So thank you for having me today. I think the main message there is just to think about all those aspects of the guidelines, not just the aerobic component, but also our strengthening exercises and asking questions around people's sitting behaviours as well. I'll pass over to Janet now to wrap up.
Thanks, Aaron. It's always good to have a refresh on all of that stuff. Makes you think, doesn't it? How long have we been sitting here? So I am Active Geelong's Walks Coordinator. The Active Geelong Walks is really got to do, the whole design of that is really to try and target our less active or inactive population in Geelong and the wider Geelong area, and try and get them to be more active by joining some safe supported walking programs that we host. And we host these walks under the Heart Foundation's program. So it's all available to find our different walks on the Heart Foundation's website. So that's a really good thing just to keep in mind, because there are a number of other walks as well that are Australia-wide. So I believe there's quite a few of you joining us from the wider Victoria regions. So if you can't, most of Active Geelong's walks are obviously in Geelong and close by Geelong, but if you jump onto that Heart Foundation website and look up their walking programs, they've got walks all over Victoria. So that's just worth kind of keeping in mind, that anyone can join any of those walks. So if you've got patients who would be interested in joining a walking program and they're not within our region, you can certainly look on that website and find a walking program that they could join. But the walks with Active Geelong initially actually started pre-COVID, and they were trialled through a handful of GP clinics, of which Hugh's was one of them. And they were very successful up until they hit that COVID point, successful enough to be able to generate a report that was published in a medical journal. But then post-COVID, obviously over COVID, it all kind of was very difficult to continue. So then post-COVID, the PHN partnered with Active Geelong to try and re-begin these walks. We re-began them with a slightly different structure to where it had been. I guess initially it was really for the GP clinics to try and run their own or organise their own walking programs. Post-COVID, the GP world was very busy, so we found it was better if we had some organised walks that the GPs could refer their patients into. Initially with the PHN's funding, we were very GP based, but we did have quite a lot of interactions with the practice nurses whilst we were trying to communicate with the GPs. And that made us realise that there was a wealth of keenness out there by the nurses to try and get their patients to be more active, and perhaps a better point for them because they're having more communication time around with care plans and things like that around their physical activity levels. So that kind of led to this whole movement of us trying to make more of an approach to you as practice nurses and see how we can support you to be involved with Active Geelong's walking programs and maybe even create your own. So we still have a number of walks that were the initial walks that started pre-COVID that we support, that are through different GP clinics. So if you again jump on that Heart Foundation website and you were looking up the list of walks in our area, you might see Lara Medical Centre, South Barwon Medical Centre, Kununurra Medical Centre and Kidinia. They're all walking programs that are run through the GP clinics and are still going today. We've also partnered with Kiza, who are obviously a physiotherapy and EP-based gym. They have gyms in Geelong, Ocean Grove and Torquay, and they have been very keen to support Active Geelong and our walking programs. And so they lead some walks from their clinics in those locations. So you will see them listed there too. Kiza, by note, to link back in with Sarah's talk, is a local provider of the LIFE program. So if you're in the Geelong region and you were wanting to refer your patients into the LIFE program, there may be others, but certainly Kiza are the providers of that for Geelong. We've also partnered with some community centres, so Bellarine Community Health and Rosewell Community Centre, to provide walking options and walking groups outside of the immediate Geelong area. So Rosewell Community Centre is in Cryo, so just north in Geelong, and Bellarine Community Health have been leading walks at Point Lonsdale and Ocean Grove. So that we have those 12 walking groups that we are now linked to Active Geelong. We have 285 registered walkers and about 15 walk organisers who we try to support. So we would love you to join that movement and come on board. There are a couple of options. If you obviously are in the Geelong area, you can simply refer. And by refer, I just mean you just simply send me an email, or you can give me a call. Your patient with their consent into our walks, and then I give them a phone call or an email and let them know all the information that they need. And then from there, it's kind of up to them whether they would like to join the walks or not. So you can refer any of your patients into our current walking programs, any of those 12 groups that I've already mentioned, but you can also look to start your own group if you were outside of that area and you were interested in trying to start a walking group. We have had some successful clinics do that, which I mentioned earlier, that Lara, South Barwon, Karanjar and Cardinia have all been examples of GP clinics who have been able to start a walk and keep that one going. So we would be more than happy to provide you with support, whatever support you need to try and do that, whether that's just having a chat with me or whether that's helping you to develop some flyers or just going through some questions that you might have about how to do that. So if you would be keen to start your own group or to refer patients, then please, just note down my email address there and feel free to send me an email. I think that's probably it. I'll jump back to Katrina and she will take any questions you have.
Wonderful. Thanks, Janet. Okay, so we've got some time, got 8 minutes left, so we do have some time for Q&A. So if anyone has any questions of our wonderful presenters today, you can just take yourself off mute if you are feeling brave and would like to ask in real life, or you can put your question in the chat. Sarah, for the benefit of people who may not have access to the chat, there was a question about whether the incentive payments for the LIFE program are still continuing. So if you wouldn't mind answering that one. Thanks.
Yes, absolutely. They definitely are, but sort of aligned with our strategic priorities to really focus on priority populations and making sure that the program is accessible to them. We now also focus on incentivizing clinics that serve priority population groups. So mainly clinics based in regional and rural areas, as well as clinics that serve higher volumes of cold populations and clinics who've got like Chinese, Vietnamese, Arabic speaking doctors, as well as clinics that serve higher number of Aboriginal and Torres Strait Islander populations. So yeah, in principle, the incentive is available, but we do have particular clinics that we focus on.
Okay. If someone wanted to find out if they were an eligible clinic, would they just contact?
Yeah, I'll put the email address in the chat, but they can just contact us on live@diabetesvic.org.au and we'll get back in touch.
Wonderful. Thank you.
Thank
We've got
you.
a second question here in the chat, just asking, is the LIFE program only available for Medicare card holders?
No, definitely not. The LIFE program is available for any patients who are deemed at high risk of type 2 diabetes, heart disease, and stroke, as per those criteria that we discussed before. So if they meet either criteria A, so if they're 18 years or over and are deemed at high risk as per the OSDI risk test, or if they meet criteria B, the CVD score, or have one of those pre-existing medical conditions that I mentioned earlier and that are also listed on our website, they're eligible for the LIFE program. Yeah, so they don't need to be a Medicare card holder.
That's terrific. Thank you.
Thank you.
Do we have any other questions? Feel free to take yourself off mute or put it in the chat. I'm not seeing any come through. So look, we'll get a few minutes back in our day. Okay, so I'd like to take this opportunity to thank our presenters today. It's always a pleasure to work with our friends from Active Geelong, and we're very fortunate to have such expertise available. I'd also like to say thanks to Jade from our workforce development team, who has kept all of these presenters and myself organised and coordinated the webinar for us today. Jade will email you a link after this webinar with email you after this webinar with a link to the recording and a copy of the presentation slide deck. That slide deck will include all of the contact details for our presenters if you'd like to follow up with them. We'd also like people to take the time to complete that participant evaluation survey either via the QR code on the screen or the link that's been put in the chat. And that's it from us. So thanks everyone for attending today and coming up, and as Hugh said, giving up your lunch break today, and we'll see you at the next one. Thanks everyone.
Thank you.